Health officials there are recalling 800,000 swine flu vaccines intended for children. They say their efficiency wears off after a short period of time. Now, it comes as vaccinations against H1N1 become available to any American who wants it. Our correspondent Priya Sridhar is in our Washington studio tonight. Priya, hi. This recall must have some people wondering what the whole point is in taking these vaccines. What is the feeling over there?
Hi, Kevin. Well, I think people have had reservations about this vaccine for a while. Previous reports showed that the vaccine may have been linked to the Guillain-Barre syndrome, and now this new report is causing many people to say, what is the point? So joining me to help talk about this is co-founder and president of the National Vaccine Information Center, Barbara Lowe-Fisher. Barbara, thanks so much for joining me.
Thank you.
So tell me about the latest numbers. 800,000 H1N1 vaccines that were supposed to be for children are now being recalled. What do you know about this?
Yes, just this morning, Sanofi Pasteur recalled 800,000 doses of H1N1 vaccine. We think that it's a mercury-free vaccine, the single-dose vials. I haven't confirmed that. But if that's true, that means that those children are going to be getting the multi-dose vial of vaccine that contains mercury. And, of course, mercury is something that a lot of parents in this country have been very concerned about giving their children through vaccination. And the issue is a lot of people in this country are not taking the H1N1 vaccine. There's going to be potentially a surplus of vaccine that will then have to be disposed of. If it's in the multi-dose vials that contain mercury, it will have to be disposed of under hazardous materials regulations, hazmat regulations, because you can't dispose of mercury in this country, mercury-containing vaccines, by pouring it down the drain or throwing it into a regular garbage can. You have to undergo hazardous material regulations.
And what are some of the concerns with the mercury? Well,
the mercury has been associated with brain injury in children, regression in children who have gotten these vaccines, regressing into autism. It's very controversial. The government denies that mercury has anything to do with these children's autism. But in 1999, our Environmental Protection Agency and the Food and Drug Administration directed the vaccine manufacturers to take mercury out of childhood vaccines. But the flu vaccine in multi-dose vials contains mercury. And so I'm wondering what's going on here with recalling these 800,000 doses of potentially mercury-free vaccines, and what's going to happen to the children who are going to get the mercury-containing vaccines.
Okay, and I want to talk to you about the latest numbers here. The latest numbers I've seen are 10,000 American deaths because of H1N1 since April. But many people are saying that, you know, this pandemic isn't as deadly as the Spanish flu pandemic back in the early 1900s. What's going on? Why are we so concerned about this?
Well, you know, there was a report issued last week out of Harvard, and one of the authors stated this may be actually the mildest influenza pandemic in history. It is showing to be not as lethal as other influenza pandemics like the 1918 or others that have occurred in this century. So I think that a lot of people are saying, you know, it's not real serious. It's not any more serious than the regular flu, and most people in this country don't actually get flu shots. Only about a third of the people in this country take annual flu shots. So what we're seeing playing out is that most people just aren't interested in getting the H1N1 vaccine. There have been about 3,700 vaccine adverse events reported to the government, 12 deaths, 10 cases of Guillain-Barre syndrome. But this is only a tiny fraction of what's actually occurring out there because most doctors don't report vaccine adverse events to the government. So we really don't know how many people who have gotten vaccinated with H1N1 has actually had reactions, injuries, and deaths.
So far, 1 in 6 Americans have been affected by H1N1. Are things going to get worse or better?
All indications are this virus is not mutating. It is not any more dangerous or deadly than regular seasonal influenza. All indications are this is a very mild pandemic. And so there's no indication it's going to get any more serious. I think you're going to see a low uptake of this vaccine in this country. And I'm hearing reports from around the world that actually in England, in France, in Italy, and other countries, there's also not a lot of interest by the people to take this H1N1 shot.
Well, we'll certainly keep you guys updated on everything related to the swine flu from here in Washington, D.C. But for now, it's back to you, Kevin.
Hey, Priya, at least a little bit of good news there, that this pandemic not as bad as they initially thought it may have been. Good to hear from Barbara Lowe-Fisher there.